I was just about to say we're going to record this meeting, if that's all right with you. You'll see that message come up on your screen. My name is Lorraine Creech. I'm Head of Nursing at Mesothelioma UK. I'm standing in a little bit at the moment because Liz Darlison, our CEO and consultant nurse, so far has led the webinars, but I'm standing in today for her. This is our 8th webinar, I think. We're having a bit of a change to what was the programme, so forgive us for that. Originally we thought we'd be delivering a programme about nutrition and exercise today, but due to some unforeseen circumstances we've had to make a change to that. So we're going to talk today about some mesothelioma projects and projects that we've been running, but we're also very glad that we have liaised with other people on some of these projects. So just to let you know what they are, we're going to talk about the Mesothelioma DAX, that's the Digital Exchange Programme. And then we've got Andrew Payton talking about Asbestos Smart. And then we've got Leah Taylor, who is going to talk about the Mesothelioma UK Trials app. So we're going to kick off with the Meso-DAX companion. And this is a patient companion. We're going to do a full demonstration on it, so I'm not going to say too much about it. But really, it's the point where patients, if they wish, will be allowed to enlist to collect data for themselves, for yourself, if you're a patient, on exactly what's happening with regards to your condition. So it may be about symptoms, it may be about your quality of life, it may be about the cost of having a condition like mesothelioma. And really it's a way of measuring your experiences and your outcomes, how you're feeling about things, and seeing how we can improve that as time goes on, and also how we can use that information to help people with mesothelioma in the future. So that's Meso-DAX in a nutshell. We're now going to go straight into a demonstration. Please remember that you can put any thoughts or questions or comments into the chat facility, and at the end of our 3 speakers we're going to have a bit of a panel to talk through things. So without further ado, Rachel is going to click on to the demonstration for me of the Meso-DAX companion.
Hello everybody, my name is Liz Darlison. I'm Chief Executive of Mesothelioma UK and I'm also a nurse consultant at the University Hospitals of Leicester. I'd also like to introduce Lee Weems. He is a director of Dash Global, our commercial partner who has helped us to develop this health companion that we're very grateful to you for agreeing to review the companion. So I also would like to acknowledge my colleague Lorraine Creech, who's also been very involved in the development of this prototype. So just to give you a bit of background, really, a few years ago now, working with Dash Global, Mesothelioma UK developed a patient experience, or a burden of disease, should I say, tool, so that we could really work with patients to measure the impact of mesothelioma on their experience of care, on their symptoms, on their quality of life, and on their finances. We completed that study, and part of that study had a digital option, so patients could complete and provide all that information using a digital platform. And it worked really well. We were delighted once we'd completed the project, but it struck us that we shouldn't be doing this just occasionally or now and again. This should be something that we collect as an ongoing project, because the actual impact and the experience of care is extremely important when we're looking at the development of health services generally. So with that, working with Dash Global, as I said, we have developed this digital prototype of the Health Companion. It's available currently for lung cancer patients and for mesothelioma patients. So that's the 2 disease areas that we're currently developing the prototype in. So just to explain a little bit how you might learn about this as an opportunity as a patient. So the intention is that the cancer nurse specialist that patients meet in the hospital setting will introduce the opportunity of being involved with the health companion. They will provide patients with a piece of information, and if patients want to get involved or explore it in a bit more detail, they will consent for the nurse to provide their contact details to a health companion manager. That will be forwarded on to the health companion manager, and with a few basic details, you know, name, mobile phone number, email address, your NHS number. The health companion manager will upload that onto a backroom system, and the patient on their chosen device, whether that's a tablet by email or whether it's on their mobile phone, will receive a link via text or email that they can click on that will open up the health companion. And this is what it would look like on your mobile phone. So this is the lung cancer health companion. And if you opted to take up the opportunity, when you first click on the link, this is what you would see. Now, I hasten to add, this is not an interactive tool. So anything you put onto it will not be notified to your clinical team, to your nurse specialist. It is intended for you to take with you to your appointments so that you can share the content of your health companion. You might use it with your family and friends to show them the pattern of your symptoms or the pattern of your quality of life, but it isn't interactive, so it doesn't flag any concerns to your healthcare team, and it's really quite important for you to know that. I think I should also add that the health companion manager will be available to support you with any troubleshooting. And the intention is we have made it so user-friendly that you will not need a great deal of support with troubleshooting. And that's what this is all about. Your reviewing it is really about looking over with a fine-tooth comb the companion and flagging up to us now as we're developing, in the final stages of developing the companion, flagging up to us any little glitches or things that you're not quite comfortable with or that you don't find very user-friendly. So just to explain a little bit further, there are 4 sections to the companion after the initial setup. So the 4 sections are your experience of care, your symptoms, your quality of life, and the cost implications of your ill health. This is the initial setup, and Lee's going to click through some of these pages. So when you first log on, can we just go back to the first page just to show, as I say, this is what you'll get. You'll click on that start button. It will take you through a basic introduction. We're going to ask you to reconfirm your contact details, change your password, and reconfirm your consent. So Lee's going to just take us through that. And there's also some details there about the health companion manager's contact details. So this is reconfirming your consent, the date that you started, and whether you would like to complete it in the next week, the next month, or in 3 months. And you can have some control over that if you would like to. And that's one of the questions we're going to be asking you as you review it. And this takes you through to your home page or your dashboard, whatever you want to call it. So, as I said, let's look at the initial setup. So when you first join the health companion, there are a number of questions we're going to ask you about the state of play now with your health problem. And this is to set the scene or to create a benchmark of where you are and what's happened. So if we just look, this one, it's click on, there's those that you've completed, and so they will move over to the completed column once you've done them. But in the still to do, when you first open up the companion, there'll be a whole list of things there that we want you to complete. Very quickly though, it's not meant to be too onerous. So if we click on your details, and you'll see there, this is more of a reconfirming, and this data should be already entered for you. We just want you to confirm that it is correct, and then to change your password, so you can password protect. Some more basic details, your name, date of birth, postcode, ethnicity, a bit about your height and weight. And that's it. Now, with regard to your clinical history, we are interested in your asbestos history and your smoking history, because these are all predisposing factors to developing a malignancy, a chest malignancy. So if we just click on asbestos history, for instance, we're going to ask you just a little bit about, from your memory, have you ever been exposed to asbestos? And Lee's just going to walk us through this. A bit about your career, what you did for a living. You might have had 3 or 4 jobs. And then if you've been offered any help to identify your asbestos exposure, we're just interested to know a little bit about that too. We're also interested to know if you've been in the armed forces, and if you have, which service and how long you've served for. And these are all very helpful when we're creating a clinical picture. We're also interested to know if there's been any family history of mesothelioma. And it's a similar thing for smoking. I don't think we need to go through that. But also in this initial setup, we are interested to know about your initial experience of care. And if we could just click on that, Lee, as well, just have a little look at some of the experience of care. So we want you to put in the first date you experienced symptoms, the approximate date you were diagnosed, how many times you went to your GP. A lot of these questions are based on a national cancer patient experience survey. And what we want to do is to collect data about people with your particular type of cancer and compare it to the national cancer patient experience survey. So the explanation of meso, was it understandable? Was it given in a sensitive way? And so on. And so in this initial setup, we're just going to create a view of what your initial experience from being diagnosed was. So that's the initial setup. And now if we can just go and look at the 4 sections. So periodically, you will be asked to complete questionnaires once you've signed up to the health companion. Those questionnaires are about symptoms you might be experiencing. They're about your quality of life. And there will also be some questions about the financial implications. So your quality of life, your experience, your symptoms, and the cost implications. And that, again, is your homepage or your dashboard. And you can click on any one of those and see where you're at with. So if we just perhaps go to My Symptoms. So if we click on My Symptoms, it will tell you when you last completed the symptom survey. And if we can just go to next. And this is the symptom survey. It's a validated tool that's used across all sorts of different health problems. Have you been short of breath? Are you losing weight? Are you thinking clearly? Have you been coughing? Have you got a good appetite? Any tightness in your chest? Is your breathing affected? Lack of energy? Pain? Nausea? And any side effects from treatment? And are you content with your quality of life? And that's it, completed. And you can save and finish that. Before you do that, you can choose when you want to next complete that symptom survey. It is likely that we, the health companion manager, will be asking you to complete it at 3 monthly intervals. But if your symptoms are altering quite frequently, you might want to complete it more frequent than that. And we would welcome you to do that. So we are going to be asking you about that when we ask you to complete the review questionnaire. Save and finish. If you wanted to then look at your summary of your symptoms, there is an option on the bottom menu for you to go to your summary. And then Lee can just click on the symptoms. And you can view this in different ways. So it will tell you how many times you've completed it and over what period of time. You can look at a footprint chart that will give you a pattern. So it looks like a spider's web, and the center shading will lean towards the symptom that is most prevalent for you, or you can look at it across a time chart, and that will show you, it will plot on there over a period of time which symptoms have been more troublesome. So if we can just now perhaps look at quality of life, this is one of the other 4 sections. So we go to your homepage again, click on quality of life. That's the last time you completed it. If we go to next, this again is a validated tool used in all manner of clinical trials called the EQ5D5L. There are 7 pages to this. So mobility, have you got any problems with mobility? Self-care, can you self-care? Your usual activities, have you got any problem with your usual activities? Any pain or discomfort? Are you experiencing any anxiety or depression? And then this is a sliding scale for how you would rate your health today. And that's it, completed. And then again, you can go back to the summary and you can look at how your quality of life has measured up over a period of time. So how many times have you completed it? What it looks like on a footprint chart. Apologies. And then on a time chart. I also just want to show you your cost section. So this is the 3rd section. And this can be switched on or off. So if you really don't want to enter information about the cost implications of your ill health, then that's entirely up to you. And you can switch this on if you don't want to take part in this part of the Health Companion. It's really helpful for us when we're doing research, for us to be able to report on the cost implications of somebody's ill health. So we'd appreciate it if you did, but we completely understand that some people want to keep their finances quite private. I think the other thing that I should mention as well is that throughout, just let Lee finish, throughout any period of time that you're signed up to take part in the Health Companion or to use the Health Companion, you can withdraw at any time. There is no obligation to continue. Of course, we'd be very grateful. The longer we can collect information about people's experience of care, their symptoms and their quality of life, the better. I also wanted to just explain that there is video help throughout. So rather than having to read pages of, accepting policies, procedures and all the rest of it, we are in the process of creating videos about each section. So you can just click on the video, listen to it, and it will tell you about that section of the Health Companion. We have several meetings planned with patients and with healthcare professionals over the coming weeks who will all be reviewing the Health Companion. And we're expecting people to, make comments and to say they didn't like this or they like that. That's exactly what we want you to do. We have prepared a questionnaire with a few questions that about things that we specifically need your advice and support on. So we'd be really grateful for you to complete that. But there is a section at the end on other. And so any comments that you've got, even if it's down to the colour or the size of the print, it doesn't matter. Any comments we'd be really grateful for. So with that, I think I'm just going to check with Lee that he's happy with that we've showed you sufficient content. Lee?
Yeah, I think done a good job there.
Lovely. So with that, we'll leave that with you. Please talk to the person presenting it to you. Contact any of us back at Meso UK. We'd be glad to talk to you about it further. And once again, a big, big thank you. We really are appreciative of your feedback. Thank you.
Thanks, that's great. I think it's always helpful to see a demonstration, isn't it, rather than just talking at you or something that that's coming online. But hopefully it will be fairly simple, and it will be mainly your mesothelioma nurse or a lung cancer nurse who advise you initially about Meso-DAX, and we'll come back to any questions or any queries about that a little later on. So we're now going to move on to our second project to discuss this afternoon, and I'm really glad to say that we've got Andrew Payton with us this afternoon, and Andrew is going to talk about Asbestos Smart, which is a simple, easy to use technological solution which gives visiting contractors and key on-site personnel immediate access to the latest asbestos register in the building. Now, we're always glad Andrew has presented at many Mesothelioma UK meetings now, and we're always glad to have him with us for his clarity and his expertise. He is the co-founder of UPNAR as a new social enterprise set up in January 2020 to prevent asbestos exposures using today's QR technology. And previously, Andrew was the co-founder and former CEO of Metro Safety Group for over 25 years. So I'm glad that he's with us now for a few minutes of his valuable time. Andrew's going to share his screen for us and take us through his presentation. And as I say, feel free to post anything in the chat.
Great, thank you very much, Lorraine. I've just made sure that I'm off mute. I'll share my screen in 2 seconds. I hope. It's always my most nerve-wracking moment, I find. Let's see if this works.
The joys of virtual meetings.
Yep. Not at this point, is it? Okay, let's see. There we go.
There we go. We can see you sharing now. We're just waiting on the screen.
That's good. Yep. That's good. And just before I go on, I just want to thank you all for having me here. I find it very interesting what you're doing, and I see how much work is being actually done. And it's nice to see some bit of digital technology being used too. I hope that today will give you some indication of what we're trying to do to stop future asbestos exposures in the UK, which is really what we want to do. This is a presentation that I've sort of tweaked a little bit for property professionals. I'll edit it a little bit as I go through, but I'll crack on because we haven't got too much time, and I'm aware of that. So let's see if this is now working. Yep. So we talk about sharing information to save lives digitally, as opposed to some of the prehistoric ways in which it is currently or has been currently shared. There's 3 sort of sections. One is about the ignorance that exists that we're trying to deal with. It's about how we take a smart IT approach to dealing with that, which we think we can do today. And it's very much about taking a collaborative approach, which is why we're a social enterprise. We need to work with a lot of people. So yes, we did indeed start at the end of January. Not the easiest time perhaps to start, but one thing you can say is that at least everyone now knows what QR codes are. We are a social enterprise. We are simply here. It's not about profit. This is very important. We are about protection of public health, and it's about the avoidable exposures to asbestos. Unfortunately, there's so much asbestos in the UK that some exposures are not avoidable. We'd love to see it all go, but that's not going to happen for 20, 30 years, I'm afraid. So meanwhile, let's manage it properly. The way that we think we can do it is a little bit of today's smart QR technology that hasn't been widely available and cheaply available until probably in the last couple of years. But it's also about working with duty holders, the people responsible for managing asbestos in buildings and helping them do their job. And there's a whole load of other stakeholders that we need to engage with too. Very, very important because of the scale of the issue. And if we do it right, we know that we're going to save lives. We know we're going to save suffering and a lot of time and a lot of money too. And last but not least, in terms of how we work, is of our Asbestos Smart license fees, which is what we charge people to have our service. 5% of these go to Mesothelioma UK. I'm sorry to say at the moment they're only getting a few £100s a month because we've only just started in post-pandemic. But I'd like to think that that could be that. Well, we intend that to be a few thousand, and if all goes well, quite a lot more than a few thousand a month. But that'll take time. The big challenge, I'm sure you're all aware of this, but it's in the UK, it's a combination of widespread issues and just the level of ignorance. And I put this up there. every time. I know that you guys will know this, but it still shocks me. But then when you look and see how many places it's actually in, perhaps it's not so much of a surprise. It's still about 1 in 5 workplaces, plus homes, but workplaces are the most dangerous place. And what that means, and I didn't realize this, and I ran a fire safety business with health and safety within it, but what that actually means is that every year there are thousands, estimated probably tens of thousands of accidental exposures that happen to asbestos with that much asbestos around. And therein lies a problem. So, and you know, I'm not going to get into debate of safe levels of exposure to asbestos, but certainly no one agrees on that. And what that means is many, many more people are at risk of becoming future victims, certainly than I ever realized. I only really engaged with asbestos because I come from a fire safety background about 3 years ago, and then I realized the situation. And the people mostly at risk, and they account for about 60% of the deaths, are people who poke around in buildings. Not surprisingly, they disturb the fabric of the building, the asbestos-containing materials, and they release the fibers. So that isn't a surprise, but perhaps more surprising is the people who you wouldn't expect to be at risk. So primary school teachers have 5 times the risk of contracting mesothelioma than the general public. And JUAC, Joint Union Asbestos Committee, I got some figures from them the other day. I think between 5 and 10,000 children, former children in schools, have died directly from exposure to asbestos in schools because 75% of schools still contain asbestos. But it's the general public. We're all at risk, but at varying degrees. But the reason that we're here and the reason that I'm engaged with this is not just to keep me occupied in my 60s, but the fact is these were avoidable. These exposures are about widespread ignorance in workplaces. Not that many people know about asbestos in their workplace, partly because people don't tell them or want to tell them. And ultimately, I'm afraid it's down to failures of management by employers and duty holders. They have a responsibility to keep people safe, and they haven't done it. But there are some reasons why they continue. It's good news that major works are now under better supervision, so much less likely to happen. But you've still got a problem. You've still got millions of minor works, people going in, changing the light bulb, changing a smoke detector, bit of plumbing, bit of electrical works. They're not under formal supervision, and they are carried out by tens of thousands, actually probably hundreds of thousands of contractors who don't have enough education, awareness, and training, despite people's best efforts. That's a problem. One of the problems, though, as well as that, is that the employers and duty holders have to get this vital asbestos information to the contractors so that they know not to disturb it when they're about to start work, which is contained in the asbestos register. And truthfully, they do sometimes. Other times they don't. If they're relying on paper, how many times is the paper folder actually not there? Or it might be email-based. Well, if anyone's tried to keep track of their emails, especially today, it's quite likely not to get to the person with the tools. And it's got worse with time pressures and staff and contractors. And we have indirect subcontractor change. So there's lots of very good reasons why the process will fail and somebody can turn up on site and not get the key information. Out of our call outs being an obvious one. But the thing that we have learned most surprisingly to me in the last 12 to 18 months is even if the information gets to them, I'm afraid that too often the documents are either inadequate, they're incorrect, or they're incomprehensibly formatted. You need to be an asbestos expert to understand half of them. Well, that's not going to work for the person with the tools. That's a serious, serious issue which we were not expecting to find. And then the last thing that would make a big difference is there's been a tendency to hide the fact that there is asbestos in buildings from people. And actually a little bit of training, a little bit of education, a little bit of information given to some key building occupants, like the receptionist who lets contractors in, can make all of the difference. To my mind, I come from a fire safety background, and this reminds me of Grenfell Tower. It's the same sort of complacency. Don't let the people know. I'm not going to bore you with all of these, but duty holders have a few other challenges. So it's not their fault necessarily. They've got a lot of issues, multiple properties, multiple contractors. It's got a little bit harder now because now they've got more partially void premises. They've got fewer people around. Everyone's pinged to death. So the chance of somebody on site knowing anything about it, or even, it's got even harder for them to get the information. But they do have a responsibility to ensure that anyone who is at risk of asbestos disturbance is suitably informed. And they struggle. They don't have line of sight across multiple properties on a day-to-day basis, and they can't prove it. So they have a problem. We think that this can be changed. We think it's all about this thing that I didn't really take much notice of until about 4 or 5 years ago, even though I had one. Now everybody has them. We call it smart IT. So we think you need smart IT to make safety compliance work. I'm not going to go into this because this is about Grenfell Tower in part, but it's the same thinking. There's a lot of things that the duty holder and responsible person has to join up. Risk assessments, contractors, and the people on site. And if you're dealing with multiple buildings, you need some IT. But that IT isn't just an IT system. The weakest link, nearly always, unfortunately, is the people on site, not surprisingly. The contractors are the hardest to address, but they're not the only people. They're the ones who are most likely to cause the incident in the building. But you've also got quite large and changing numbers of people. And it's very hard for duty holders to stay on top of those people and make sure that they get the right information. And most importantly, when and where they most need it. There's not much good giving people a bit of awareness training 6 months before they actually go and pick up a screwdriver and then actually poke around in your building. And I'm afraid the information that's given is often bloated and not meaningful and not quick. I don't think people need to know the composition of asbestos fibers to understand, please don't knock a hole in that wall. So unfortunately, it's the people on site, inevitably, they never get quite the right information instruction exactly when they need it. And I'm not going to go into the politics on all of this, but if you look at Grenfell Tower, if you look at Boeing 737 MAX, and you look at COVID, you can see the pattern. The great news is, and this is what has changed in the last 5 years, I'm someone who's spent a lot of money on IT systems, is you don't need an expensive IT system to address this issue. It's nice if you've got one and it can be helpful, but you don't need it. If IT is going to be smart, you've got to make sure that the information transfer is very fast, it's not clunky, it's not paper, and it's not email. They're prone to failure. Any instruction and training needs to be targeted. For a receptionist, it's different to a worker. It's different for a teacher. Just make sure it's targeted, clear, and brief. And if you are the duty holder responsible, the intelligent thinking, you need data, which we've seen with COVID too. And then lastly, you need to reach people on the smartphone. If you're not reaching people on the smartphone, you're not really reaching people where they work. So what you can see here is very simple. It's an Asbestos Smart asbestos management notice. And all we do, I say all we do, is we will take anybody's asbestos register, make sure it conforms to HSE format, not format, standards. If only there were a simple format, it would be helpful. Make sure it's in a mobile-friendly format, give it a unique QR code, make sure it's then incorporated in an asbestos management notice. That can be tailored to organizations' requirements. And then if you take your mobile phone and you're used to scanning QR codes, you can do it on the next one. You can scan the QR code. You can see where the asbestos register is, not a 50 or 150 or 250 management survey that you've got to decipher. And you can see whether it's safe to proceed to work. So these signs should be incorporated into signing in processes for contractors, but you may have them strategically placed elsewhere. So in schools that we've been targeting, we have them in teacher staff rooms, so all the teachers can actually know. If you've got plant rooms, you've got people going to there, you may well have them there as well. So if you just want to take a moment and put your camera over there and click on it, you'll get, I'm not actually sure which one you will get, so, oh, there you go. This is for, well, we've anonymized it, but that's fine. So there is not a 100-page document. I think this has now got, oh, well, this has actually got 3-4 pages. We try to keep things in a format that's legible, that's less than 10 pages if we can, so that then the person can see it on their phone, they can expand it or their smart device, and they can carry it around with the building. in the building, and they can go, great, I don't need to disturb it, or I need to take extra caution here. And that is so different to the way that they currently get that information. That's what you would have seen. Don't have to explain QR codes anymore. Very important here, these Asbestos Smart management notices, there might be exceptions, but the way we're operating is no authentication is required. So no account, no details, just scan the code. Now, if people don't want everyone to scan the code everywhere, then you have to be a bit more discreet about where you locate your signage. Extra things there, just the duty holders who never actually know what's going on their site now have proof of when it's been scanned. They don't have the identity of the person, so they're going to have to cross-reference, but at least they know if they've got contractors going to the building, they can see if it's actually, if they've been using it, or they've got site managers there that are meant to be using it, or receptionists, they can actually see that they're following due process. And in the event of an incident, which we had not so long ago on one of our properties, they were able to sort it very quickly. So, and then we just done a couple more things, probably since I've last presented to yourselves. If you've got larger premises, we can add some extra features. So if you were to scan this one, which I'm not going to suggest you do, you can actually have different asbestos registers for different blocks. So a school with 5, 6, 7, 8 blocks or 10 blocks, instead of having one long document, it can click through here into reception. It'll see several links, and they can go block 1, block 2, block 3, and then get a simple asbestos register for each one. And they can store other asbestos documents, which also, by the way, tend to get lost. It is astonishing how often they get lost, and then they have to spend a fortune having them all done again. Very important, it won't work on this one, but contractors need instruction. So we have a little video, we have a little QR code there, that will take them to a link for an instruction video for contractors. So actually, how do you use an asbestos register? Or we've done one for teachers, as it happens for the occupants. So if you, instead of going, oh, I don't want to tell the teachers, which by the way, you're legally obliged to do so, you go, look, we're doing a really good job here. You do have asbestos in school, and this is how we're managing it. And if you just understand this, 2 minutes later, you understand enough, and then you've got the register there. So we're using QR technology to get the information to people in digestible format when and where they need it. The benefits are pretty damned obvious, really. It's an up-to-date register, not an old one. It's well, it takes about 5 seconds. It's 24/7. The fact is, reminders people that ACMs are present in the building. Different people feel differently about that, but I believe the culture is changing. And actually, more and more people are saying they want people to know. What I said before, the probably most important thing is they're not getting a 150-page indecipherable document. Obviously, it'll save a lot of time. Very important, we're not aligned or allied to any consultancy provider. We will take any consultancy's register, make sure it conforms to HSE standards, and upload it into the system and format appropriately. If it doesn't, we won't. Similarly, IT systems. We're not trying to be a massive IT provider, and indeed we work with other IT providers to try and make it as seamless as possible. That's the ultimate aim, is just making it safer for everybody. This, not so important here, but if people have got multiple properties, there are portals out there. They may not need us, but if they can't afford an expensive portal, we have an inexpensive one. That's the technology, really, really simple, which is the point. But it's not going to be enough. The whole point really is about taking a collaborative approach to delivering the change because of the scale. So we know the culture needs to change. The awareness is phenomenally low, and there are too many exposures. And so we're trying to work with quite a wide range of stakeholders, what we call win-win-win. And we hope that we're managing to do it with public health awareness meeting digital technology. I'm going to skip through that. I'm pointing out that it's cheap. It's below £200 for an average site. Do it right, it's going to make a big difference. I'm conscious of time. We've got other things that we're going to be doing. So it's not just the smart registers, but a database of contractors awareness training records, and ultimately a database of all UK buildings with asbestos, and lots of free education. And these are the sort of people that we're working with. So a wide range of people. We've had some fantastic feedback. We're in about 300 premises. That's a lot fewer than we would have hoped, but then it has been a strange year. And we're now trying to build critical mass. So what we are asking is people to follow us, introduce us, join us, adopt us, contact us. In terms of introductions, just pointing out that I pointed out that Mesothelioma gets 5% of all our Asbestos Smart revenues. If you make an introduction to us, we have a 10% introduction. You just have to give us the details and we follow through. And that can go to well, can go to you if you like, but it can go to your charity or whomever you wish to do so. Because it's the only way it'll work is through introductions. We've had some nice feedback from lots of people. My favorite, however, is the one at the bottom. Sean Daly, site manager, said it's a no-brainer. It's something that we're hearing quite a lot. And we hope, this is our final aim really, is we want it to be the norm for people to ask and see the asbestos register in their workplaces. At the moment, they can't and they don't. We'd like people to be aware of the care that needs to be taken. And because the public sector's got most of the asbestos that's dangerous, we'd like 80% on a national register. If we do that right, we'll make the difference. We are actually about to raise, we hope, about $250,000 on a public investment social enterprise platform called FX. I'm not allowed to say, I think, more than that, but people will be able to invest. We're going to reinvest that so that with a little bit of luck, we can stop accidental exposures and save people from mesothelioma. Our dream, of course, is for everything to be gone, but as that's going to take 20, 30 years, the least we can do is this. Thank you.
That's brilliant, Andrew. Your presentation's always blown me away by the complexity on one hand, but the simplicity on another. So it's absolutely amazing. I'm sure we'll have some questions or some points coming through for that. So we'll move on to our third speaker, who is going to tell us about the Mesothelioma UK Trials app. And I'm very glad to introduce Leah Taylor, who is our Mesothelioma CNS, that's Clinical Nurse Specialist Team Leader for the North of England. She's put a tremendous amount of work into this app, and many times I'm sure she's wondered what Liz and I are asking her to do, because it has taken her to the limits and she's done it so well. We're really glad to have Leah as one of our Clinical Nurse Specialist Team Leaders. She's based in the North Tyneside General Hospital and covers the northeast of England as a mesothelioma clinical nurse specialist, and as I say, the whole of the north of England as a team leader. Leah qualified in 1996 and has been a lung cancer and mesothelioma specialist nurse for the last 10 years. Previously, she worked at the Marie Curie Hospice in Newcastle, and also has had a big part to play in her career in medical education. So she's going to educate us now on what is becoming part of our practice as mesothelioma clinical nurse specialists. You're on mute, Leah, I think.
That's a good start. There we go. Thanks, Lorraine.
You're
Just
welcome.
try and share my screen there. Is that coming through?
It is.
Yeah, fabulous. So clearly I need to revise that just a tiny bit, Lorraine, because it's now 15 years since I've been doing that, but I'm a little bit older, a bit grayer, certainly a little bit grayer after working on the clinical trials app. So has that come through with full screen? Yeah. Okay, so thanks very much for asking me to speak today. So this clinical trials app's been something that I've been trying to develop for the last few years, really, and definitely had really got off the ground, and then COVID came along and put a stop to that, like it did with most of our lives, really. But very grateful to the developers for a really big push this year, and we launched the app finally on the 1st of July. So yeah, a few sleepless nights and early mornings working on it to get it up and running, but really pleased with how it looks. So hopefully a few people joining today might have been able to download the app. So I'm just going to take on a very quick whistle stop tour really of what the app is there to do. As Lorraine knows, I'm a massive technology fan, having got Lorraine at an international conference to put a ticket on her phone to go through the airport. So she knows that this is right up my street. And does like to refer to me as the technology guru. Having seen what the rest of the things are capable of, I'm a little bit peeved because I don't have a QR code. Well, actually, we do have a QR code, but it's not on this presentation. But I don't have an interactive phone like Liz's really clever presentation. So that's got to be worked on, certainly. So firstly, about how you can get the app onto, so this is phone and tablet compatible, and it's available on the Apple and Android platforms. So essentially the only thing you need to do is go to whichever app store you use for your device and search for mesothelioma. And you'll see there the one in black, that's for the Apple store, and the white one, that is for the Android store. And then download it. It's free to download. If anybody's tried and had any particular problems, if you can pop that in the chat, that would be really useful to know. But essentially what you'll see on your phone is that little icon there, that little square with the Mesothelioma UK logo inside. And that's essentially all you need to do. You don't have to register for this app. We don't collect any details at all of anyone who's downloaded the app. The only data we can get from Apple and Google is how many people have downloaded it and accessed it. That's all we can get. We don't get any details from anyone who's downloaded it. So that's it. Once you get it on, we wanted to make this app pretty simple, really. And the reason for the app was to try and keep the clinical trial information as current as we possibly could, with that awareness that the fabulous pullout that comes with the magazine and is on the website has the potential to go out of date and not be as easy to update. So we wanted people to have very much at their fingertips up-to-date information about what mesothelioma UK, what mesothelioma trials are happening in the UK right now. So it was really designed with patients and carers in mind. And so a few tweaks compared to how we have the information on our clinical trials pullout and other information that you can find on the internet. It's hopefully a little bit more user-friendly and a little bit less of the trial and medical jargon. So when you first click onto the app, onto that little logo, you will see this page, this home page. And essentially all the bits that you need really about clinical trials are in that list. So I've gone through a few of them, not all of them though. So the About Mesothelioma UK section, that's really self-explanatory, tells you who Mesothelioma UK is, and there's a link on there that would take you to our website to meet the team. So it would meet the team of nurses. You could see who the nurse was in your area. The app has very few links. Sometimes what I find what happens with apps is that because I'm nosy, I start clicking on lots of links and then I get lost and completely lose where I was in the first place. This app actually has very few links, so it's very, very limited ability to get lost in it. So that's the main sections that you'll need there. So if we come firstly, say my technology only involves the use of a green arrow by PowerPoint. So if you look in the click on the About Clinical Trial section, it just gives you a little bit of information to set the scene. So all of that about clinical trials with the phases of trials, the stages of treatment, etc., are just things to try and help people understand the world of clinical trials, which is quite complex, if I'm honest. So not every trial obviously will be suitable for every person, and it'll very much depend on what the trial is, the stage of treatment, and various factors. So there's several things to think about. So it just gives you a bit of information to set the scene. If we go into stage again, it'll talk about stages of the treatment, not the stage of the cancer, but the stage of the treatment. And that's important when we are thinking about what setting this trial is being offered in, whether it's a first line trial or a second line trial, or what the researchers are using that for. The other thing that it talks about on there is this thing called performance status, which people might have heard their doctors or nurses talking about. So a bit of information to set the scene, because that can also help people to understand whether or not a trial or treatment might be the right thing for them. Things to consider, we thought we should put in, because just a few things there about, you know, would I have to travel? Will I get financial help? Does it cost anything? All those kind of things that might be going through your head about, well, how does the trial situation work? How does that differ from treatment that I might have in my local hospital? And then just a little bit of information about how to take part in trial. And essentially, you know, a discussion about trials should be between a patient and their healthcare team. So, you know, that's really important. If you're reading things on the app about trials, that the first thing you do is go and talk to your healthcare team about it, and they will hopefully help you understand whether or not that's the right thing for you. So then if we go into the main section, this is about the finding clinical trials, so the important bit. And we thought about having a search function, but that sometimes, because of the terminology that might be used, it could still bring up multiple trials. So if you search mesothelioma, it'll bring up everything. So we found that it was actually going to be a bit too complicated to add a search function. So we've tried to section out the trials so that understanding the basic information about trials hopefully should help you understand where to look. So if we look firstly in first line trials, and if you click onto it, it'll bring up, currently it brings up two options, and that's atomic meso and beat meso. So we're just going to look a little bit closer into atomic. So when you click onto that atomic meso, it'll bring a list, and not every trial will have as big a list as this, but it'll bring a list of every center that is currently open to that study. So you could click on the one that's nearest to you. So I've clicked on Edinburgh there for the purposes of this demonstration. The other thing to note is that if we've had any information, or I've had any information to say that the trial might not be running at that center currently, rather than completely take it out, if it's likely that the trial might open, is you would see any information about that on that page, on that first page. So if you look at that on the list of sites, if you look at that top one that says Atomic Tyneside, and you'll see there that it says recruitment at this center is currently, and that would say currently paused. If you were to click on that entrance, entry, the first thing you would see at the top in bold is that recruitment is currently paused. So you would know that that's not a possible center at this point in time. And then hopefully once that opens, that'll be removed. So I've used Edinburgh as the first example. So if you click on the Atomic Edinburgh tab, then it'll bring up all the information for Edinburgh. And it'll bring up, I've highlighted that star with the green arrow, which I'll come back to a little bit later. Just keep the star in mind. So it'll bring up a few different things. Every single entry where the trial is running will bring up the same information. So it'll bring up that what the trial is, what type of treatment it is, and who it might be eligible for. It brings up how the treatment's given, what the treatment regime looks like, and how it's given, this performance status that I talked about before, and then gives a bit of information about whether or not it might be suitable for you. And what I've tried to do in describing that is actually put that into something a bit more understandable than the information that's currently listed if you look at something like clinicaltrials.gov, which is really quite scientific, quite medical jargon. So we've tried to look at that and make that a little bit more understandable. If you did want to go and have a look at the clinicaltrials.gov, which is the big database of all the clinical trials in all disease types, then it does give the link to the clinicaltrials.gov that you can see there, just with the little computer icon, and there's a hyperlink there. And if we move on to the next one, that's just the rest of the page there. So, and it tells you the trial might not be suitable if you've had any of the following. And this is why it's important to go and discuss that trial with your healthcare team, or you can ring the Mesothelioma UK information line, and that number is given at the bottom of each page. There is, the link is there again for the clinicaltrials.gov, and then there's a contact for healthcare professionals to get in touch with that team about more information. So I've just highlighted there on the middle image. So again, that star, and then the little location icon. So if you click onto that, it will then take you on to the next one where you see the map. So you can see that I click this, so I'm there in in the northeast, my little green dot there in Newcastle upon Tyne, and you can see that trial is based in Edinburgh. If you were to actually zoom in onto the map on your phone, you would be able to see the exact location. And there's also, as you can see with that little green tab, there's a function to give you directions as well. With the map function, so I've used Assess Meso as an example there, because it has multiple sites, as you can see for that by that map. So if you were to click on the Assess Meso, which is in the Observational Study tab, then and click Map, it would show you every centre that is currently open to that study, or every centre that has that study. So you'd be able to see across the UK. I'm not quite sure why the lovely Christine in Plymouth has fallen into the sea, but actually if you zoom in onto that, she's not in the sea, she is actually in Plymouth. So it just shows you, it shows you the reach of clinical trials, which I think is good, but it also shows where there's gaps as well. So for us as mesothelioma nurses, we can certainly highlight that where there's, it's very evident where there's gaps in trial provision. If you then were to go into, say you were to want to know what's the directions from my house to that centre. So I've used Pennine as an example there, hit the directions tab and it will take me, it would open it into a new window. So it doesn't open within the app, it takes you into a new window. So you have to say that's okay. And it will give you directions by car. It will give you directions on foot. I discovered it would take me over a day to walk to Edinburgh. It will give you directions for public transport. It doesn't seem to be able to give you flight or taxi, but pretty much everything else. So if you remember the star that I talked about, that is to look at. So if you go, just go back. If you were to say you are looking at Atomic and you wanted to remember that for Edinburgh, you could click that star and then that would add that to your favorites list. And then on that main list, you'll see a little star and it says My Starred Trials. So if you click on that tab, it will bring up anything that you have added via that star. So you just click the star in that top corner and it would add it. And then you can also see a map of where those trials are. So that's just 2 that I added randomly. So I can see that Atomic was in Edinburgh, and then down on the bottom, I can see that Beat Meso in Cambridge is down on the bottom. And if you just tap on the little pin, it will tell you the information about the study, and you can bring up more information in that screen that you're in. So to avoid kind of having to go back to get information again. One thing to say about the app is it does have a home button, as you can see on that bottom tab, but the home button doesn't work as a take you back to the start. You'll see there's a back button, and that's the thing that takes you back the pages. But there's not lots of pages, so again, it's not that easy to get lost, hopefully. If you do want to use the location function, there's a couple of things you do have to make sure are switched on. So when you first load the app, it may ask you if it can use your location, and it may ask you if you want push notifications. Now with push notifications, I know we all have lots and lots of apps on the phone and we don't want them talking to us all the time. The only time, so anyone who's got the app might have seen the one that I sent a couple of weeks ago. That was just to inform people that a couple of sections had been updated, and that's as much as probably would happen, or a centre is closed or a study's closed. So we imagine that'll be fairly infrequent, so it's not be that you're getting constant pings from your phone from this app telling you new things. So you do need to turn on your location services if you want to use the map for it to do directions from where you are, and you would just go into the settings tab, which is that little round sunshine, and it will likely say enable location services. Mine's obviously turned on, so I would have to turn mine off. That blue bar wouldn't be there, that just shows that would show your postcode. Then finally, the links across the bottom, they would just take you at a touch to our Facebook page, to our Twitter account, and then some really useful information to Mesothelioma UK headquarters. With the phone, just tapping on that phone icon would take you straight to the phone. the website and to email and our opening hours, etc. as well. So that's really just a whistle stop tour. It hopefully is very simple to work. If there's any researchers or anyone who sees anything incorrect in there, please do feel free to tell me. It relies on everybody really to keep this up to date. So I do appreciate people who already have been emailing me to tell me that and I have seen little errors as I've been going through as well, just in the punctuation and things. So yeah, that's probably everything from me about the app, Lorraine.
That's brilliant. I think hopefully all of the audience can see that information is certainly the key, isn't it? I'm going to take the chairman's prerogative just to extend the webinar for a couple of minutes, if that's all right with everybody. Liz is going to join us as well for the panel. I think Liz is out there, Liz Garlison, just in case we've got any questions. Just seeing if there are any more questions coming through. I've got a couple here. Mind-blowing, isn't it, all of this? But we can see how it's all there to be seized upon, the information, how it can help patients and carers and professionals alike to really move forward. We've also, I see we've got Lee Weems, who's joined us, who we mentioned earlier, who was alongside Liz in the demonstration. He was doing all the directing, and we could see him then. So that's great. Couple of questions, Andrew. For you, really, have hospitals taken up Asbestos Smart as best as you know?
Well, we were just about to go into hospitals with some pilots. We actually got 3 NHS trusts lined up, but unfortunately, it all got waylaid by the pandemic. So we did speak to them a couple more times. I have spoken a couple of times since. I will actually be going back to them for this next phase. So to be honest, what we realized is they just don't have the resources. They haven't had the resources. So, but we will be going back. We had enough interest to suggest they have the same needs as schools. They're public buildings with a lot of asbestos. We'll be going back.
And what's your ultimate aim for Asbestos Smart?
Well, ultimately, we will work with the industry, the asbestos consultancies, the systems providers. What we want is all this information exists out there. Well, almost all of it, because it's a legal requirement. People are sitting on this information, but it's just they've lost it. It's out of date. It's unreadable. What we'd like is all of this information turned into what we would call Asbestos Smart registers that people can access on site with a mobile phone. Eventually, even off site, but that's a little bit more complicated due to data and everything else. The aim is that anyone can go into a building, see where the asbestos is in seconds, and know whether it's safe or not.
And have you got a view on the bigger organisations? Really topical for me today. We've had a query through to our information line from a lady about council houses, really, and asbestos in the roof and how councils have dealt with that. Is there any way that UK Smart could work with councils?
Yes, I think we ran a webinar the other day, and a local authority from I think it was from Rhondda actually contacted us as a result of that webinar. And interesting enough, they're taking what we're talking about to the Welsh Assembly, where they sit on the board for asbestos management. So yes, housing. I talk about workplaces, but housing associations have particular needs, and they manage a lot of asbestos, and we're talking as well with Peabody Trust to try to find them. Every sector's got a slightly different need. So we want to be talking with what we call the key segments, and the housing associations and local authorities, they kind of overlap, but are very much on our list. They probably manage, those people alone probably manage over 50% of the buildings with asbestos in the UK, local authorities and housing associations.
Music to my ears, because the query actually was from Wales today, so I'm glad to see that it's been taken on to that higher level. Yeah. That's absolutely fabulous. I can't see any more questions or queries in the chat. As we always say, you can always contact our information line at 0800 169 2409, or you can contact us at info@mesothelioma.uk.com. Just going to give Liz and Lee, just if they just wanted to add any comments at all.
Hi, Lorraine. About the Asbestos Smart.
What about anything about Meso-DAX or either?
No, I saw there's a couple of questions come into the chat for DAX. That,
all right, sorry.
Let me just have a little look. I did
No,
see.
I see those then. I think I may have answered them. One was
you've
about
answered them.
Whether it was just on a phone, or whether it was on a tablet or a PC. That came from Mavis, who's always great with questions. So basically, we're running out of time, but thank you. And as I say, if you've got any questions, don't hesitate to ask us at all. Our fundraising team wouldn't thank me at all if I didn't just mention a few things that are going on at the moment. Up and coming events, we have the Vitality Half Marathon in London, which is very soon to be upon us, I think, and we've only got 3 places left for that. That's on the 30th of July. Also, Moves for Meso, take part in Moves for Meso. If you look on our website, there's all the information about that. Lots of people are looking onto that and how they can help with fundraising. You could run a 5K, you could do for 5 days, or you could do 10 star jumps a day or anything like that. And anything, it doesn't have to be massive, but Moves for Meso is always very helpful. And just on the horizon, we have our Patient and Carer Day on the 1st of October this year. Again, a virtual event this year. And if you go to our website, there's more information about that and how to get a ticket. And our next Meso Matters webinar is on the 23rd of August, when I'm very pleased to say that Professor Paul Bass, who's a chief thoracic oncologist, will be taking and has a particular interest in immunotherapy. He's based at the Netherlands Cancer Institute, and he's a professor in thoracic oncology at the University of Amsterdam. The nurses in the audience don't go to a major conference without listening to Paul Bass, because he is a guru and a font of information about how we can take treatment forward for mesothelioma. So I'm sure everybody will find that webinar very helpful as well. Thanks for joining us, Lee. I don't think we've got anything just to add at the moment. It's great to see you there, and hopefully, you know, if we pick up anything else, then we'll be able to put it through to you. Okay, Liz or myself obviously can always ask any questions of Lee. Sorry, Lee.
Yeah, sorry, I just hadn't, I came in a bit late into the meeting, but if there is any questions or anything, obviously I haven't been following what people have been asking, but if there is anything I can help with, let us know.
Thank you. Okay, folks, thank you for joining us. It's been great to have you all with us this afternoon. I hope you found it helpful. We're always working on mesothelioma projects. I'm so very grateful to our contributors for this afternoon. Many thanks.